controversy that combines two American obsessions, body size and social media. We're talking about so-called fit moms, women who work out aggressively while pregnant, all the while posting pictures and videos on Instagram. The backlash has been intense, and here's my Nightline co-anchor, Juju Chang.
It seems nothing will prevent 31-year-old Stacey Vinagro from getting to the gym, not even pregnancy. She spent so much of her life training for fitness competitions, a three-time champion of Miss World Pro. But now Stacey's famous for being fit in another way. She's a so-called fit mom. Stacey's part of a group of Instagram mothers, or mothers-to-be, who've gained social stardom for their highly ambitious workout routines, baby or not.
They're working out, whether it's walking every day or it's doing CrossFit every day. That's what a fit mom is.
Stacey, who gave birth to her first child, Aiden, in March, says she worked out for the entirety of her pregnancy, right up until the day she gave birth.
My workout routine consisted of 6 days a week of weight training, and then I did 3 days a week of cardiovascular. So I was doing box jumps, stuff like that. As long as I felt good, I would do that.
She decided to document it all on her Instagram account, sharing her workout videos and belly progression photos with her 13,000 plus followers.
Because a lot of people look up to me and they see me as inspiration, I felt like this next chapter in my life, I got to show them, like, you can still work out when you're pregnant as long as you feel good.
But with the popularity came backlash. The more attention her account got, the more criticism she got.
Somebody said gross. Somebody put like a weird face. As a woman who has battled her weight her entire life and whose pregnancies made their battle even more challenging, it's kind of hard to view this without wincing.
New mother Sia Cooper also knows what it's like to feel the internet's wrath.
Some of the comments I've gotten, my baby is going to die, and my baby is going to hang itself with its umbilical cord.
Like Stacey, she worked out intensely throughout her pregnancy.
I worked out until the day that I gave birth. I did about 30 minutes on the treadmill, and I did barbell curls, I did barbell squats.
Sharing every step of it with her nearly 200,000 followers on Instagram.
A lot of the ladies that follow me, they seek inspiration and keeping, fit during pregnancy.
Pendulum swinging in another way. Stacey was criticized for being too in shape, getting called out for her six-pack stomach while pregnant.
Somebody wrote she didn't let her body stretch for the baby to grow. She will end up with a muffin top and probably have to have surgery to correct it.
Stacey Vinagro, who's a personal trainer herself, says much of her shape during her pregnancy came from years of athletic work.
I've always had a solid core because my body has been so fit leading up to this. It was going to take a lot just to get a big giant belly.
I guess they're still stuck in this old age thinking that pregnant women should, not work out.
But it was after having her baby that fit mom Sia Cooper got the most flack.
A lot of my readers had asked me, hey Sia, can you post, pictures of you after birth? Can you document, yourself losing the baby weight? And yeah, I got backlash, that basically I'm boasting.
But Cooper, who gained 30 pounds while pregnant, says she lost most of that weight after giving birth from watching what she ate.
In this documentary, we are going to review articles on how exercise affects women and their pregnancies. Exercise is becoming a popular trend, but there has always been myths that exercising while being pregnant is harmful to the fetus. Exercising while pregnant is beneficial and not harmful to either the mother or the child. In this documentary, we will discuss the physiological changes of a woman's body, list the benefits and risks of exercising, and finally show you the recommended exercises that are prescribed by trained physicians.
What is your opinion on the effects of exercise during pregnancy?
I think it's really good for women to exercise during pregnancy within their own limitations. Obviously, even before pregnancy, everyone has certain things they can and cannot do, so I think it's especially good for those that are exercising to take extra caution while pregnant.
Well, obviously I can't speak from experience, but it seems like the few people I know that have exercised a lot during pregnancy maintain a healthier body weight afterwards.
Exercise during pregnancy can be very beneficial. You should never start an exercise program if you haven't been exercising before you get pregnant. But if you have been exercising, continuing on while you're pregnant is good for you. It's usually safe. You should always consult your physician to make sure that you're doing and following recommended guidelines. And then as you get more towards the third trimester, exercise programs need to be adjusted. Some exercises need to be avoided, especially ones more involving contact or higher risk. But in general, it's usually a good idea to keep on exercising while you're pregnant.
Many people believe that exercise is both beneficial and harmful to women during their pregnancy. Shortly after becoming pregnant, many women do not know what kinds of exercise is recommended or if exercise is even safe during pregnancy. In a recent study done by Kelly Evanson and Cherise Bradley, 1,306 pregnant women were asked about their beliefs regarding physical activity and exercise at 27 to 30 weeks gestation. The results of the study reported that 78% agreed that most women can continue exercise during pregnancy. 68% agreed that most women who never exercised could begin exercise during pregnancy. Less than 8% agreed that pregnant women could continue to exercise even if becoming tired or exhausted. Most agreed that regular exercise was better than irregular exercise during pregnancy. Few agreed that pregnant women should not exercise on their backs in the first trimester. 93% agreed that standing without moving should be avoided. While almost all women agreed with the benefits of light exercise, fewer agreed that there were benefits with moderate or vigorous exercise. Most also agreed that there were many benefits of physical activity during pregnancy. 94% agreed that exercise could improve labor and delivery, and 75% agreed that exercise could improve the baby's health.
So let's begin by looking at the physiological changes in pregnancy, beginning with the respiratory system. The respiratory system is important in delivering oxygen around the body and also removing carbon dioxide, which is the waste, out from the body. In pregnancy, the uterus enlarges, and this will cause an increase in intra-abdominal pressure. As a result, there will be more of a diaphragmatic breathing in a pregnant lady. Similarly, because of this mechanism, there is hyperventilation and an increase in tidal volume during pregnancy. Cardiovascular changes in pregnancy include mainly there is an increase in cardiac output because there needs to be more flow to the placenta. The increase in cardiac output is a result of increase in heart rate and an increase in stroke volume. In the vascular system, there is a drop in resistance. There is a drop in resistance in the vessels, which actually contributes to the increase in stroke volume of the heart, and thus the increase in cardiac output. During pregnancy, there is actually a drop in blood pressure, usually. Changes in pregnancy. We see an increase in plasma volume by 40%. The increase in plasma volume is actually what contributes to edema. So in pregnancy, peripheral edema is actually a normal feature because of the increase in plasma volume. The other important hematological change is there's an increase in red blood cell volume by 25%. This is important to take into consideration because the two changes we just talked about actually lead to anemia in pregnancy, which is another common finding, anemia. This happens because there is a much larger percentage increase of plasma volume compared to the increase of red blood cell volume. This means that there is a net less number of red blood cell per volume of plasma, thus causing anemia. Further, in pregnancy, there's actually an increase in clotting factors, and thus pregnancy is a hypercoagulable state. This is actually a kind of dangerous thing because a common complication during pregnancy is deep vein thrombosis, and deep vein thrombosis should thus be on the radar of many health workers. The musculoskeletal changes seen in pregnancy is usually a result of the uterus growing, the uterine enlarging. As the uterus grows, there will be changes in the abdominal cavity, and this will contribute to some of the following findings. We see an increase in body mass index. Throughout pregnancy, it's normal to gain between 10 to 15 kilograms. There will be presence of stretch marks, lower back pain, lordosis. There's an increased risk of developing carpal tunnel syndrome, sciatica due to compression of the nerve around the buttock, upper thigh, and as well, muscle cramps are also a common feature in pregnancy.
So now that we know the effects, how does that affect exercise? Dr. Wang and Dr. Apgar wrote an article saying that increase in lordosis creates a shift in the gravity. An increase in joint laxity creates a higher risk of injury such as ankle sprain. With mild exercise, pregnant women have greater increase in respiratory frequency and oxygen consumption. But at high exercise, the oxygen demand overwhelms the adaptive changes that occurred in the body. When women become pregnant, the energy demands of their body increase. So when exercise is added, that increases energy demands even more. There has been some evidence that shows exercising through the third trimester decreases fetal weight. In a study done by Dr. Clapp, it was found that there is a decrease in fetal birth weight by approximately 10 ounces. Throughout history, there have been many myths believed about the harmful effects exercising while pregnant may have on the mother and/or fetus. While during our research, it was evident that the present consensus is that there are little to no risks to exercising while pregnant if the mother has no contraindications that prevent her from healthily doing so. It is advised that each expecting mother consults with her healthcare provider before she begins any exercise regimen. This is especially important if she was not physically active prior to becoming pregnant. Popular concerns about exercising during the gestational period that have been expressed is that exercise would cause fetal distress, as blood flow would typically be received by the uterus instead transported elsewhere, that the exercise would cause premature labor, that the baby would be born with small gestational age, or that the baby may suffer from neural tube defects. All of these concerns have been well researched, and there has been no validation to support that any of these may be harmful to the mother or the fetus. Dr. Nahid Esmerli, even though there may be a reduced volume of blood transported to the uterus during maternal exercise, compensatory mechanisms exist that warrant consistent fetal oxygen consumption. Some studies have shown a small gestational age in the offspring of women who exercise while pregnant, but the weights are still within normal ranges. There has been no signs that the birth weight differences have had harmful effects to the infants. It was found that it is safe for healthy pregnant women to participate in regular moderate exercise. Exercising will not affect the chances of preterm labor. Dvorsky and Longo found that exercising actually decreased the risks of preterm labor, as well as having a child that was small for gestational age or large for gestational age. In their study of over 80,000 infants, mothers who exercised for 5 or more hours a week reduced their risk of preterm labor by approximately 18%. The ACOG provides contraindications to exercise in pregnancy as well as relative contraindications for aerobic exercise. These include heart disease, lung disease, incompetent cervix, etc. Those for aerobic exercise include severe anemia, unevaluated maternal cardiac arrhythmia, chronic bronchitis, and more. If any expecting mother experiences the following symptoms, they should stop exercising immediately and contact their primary health provider and/or obstetrician. Symptoms of vaginal bleeding, dizziness, headache, chest pain, muscle weakness, and more are reasons to stop.
Nice. What's your background like? Where did you go to school? Your MD?
I went to medical school at the University of North Dakota here in Grand Forks, and then I did my residency in OB/GYN at Mayo Clinic in Rochester, Minnesota, and then I came back here close to home to practice.
Can you explain why you are an authority on this topic?
So I probably should mention, before I went to medical school, my undergraduate degree was in kinesiology. So I have a lot of background in exercise physiology and biomechanics to start with. And then throughout residency, I found that one of my passions about pregnancy was helping women to ensure that they could have a healthy pregnancy. And so I did research in exercise and pregnancy in residency as well, and I helped create some prenatal exercise and wellness programs at Mayo. They have a gym facility that's affiliated with Mayo Clinic for their employees and families, and so we created some prenatal exercise programs, and they were a huge success there. And then I helped get the exercise and pregnancy program started at Choice here when I moved here to Grand Forks. So they already kind of had the ball rolling, and I helped them get off the ground.
What are some myths that you think women most often believe about exercising while they're pregnant?
So I think a lot of women are scared to exercise in pregnancy, and they don't want to do anything that could potentially hurt their pregnancy, obviously, and there's a misconception that exercising could be harmful to their pregnancy, when it's actually the exact opposite. So it is safe to exercise in all trimesters of pregnancy. There's a few contraindications, certain medical conditions or pregnancy conditions where we wouldn't advise someone to exercise in. But for the most part, for the majority of healthy pregnant women, exercise really only has benefits to them as long as they follow a few modifications and avoid exercises that could potentially cause trauma to their.
What are some risks involving exercise during pregnancy, and are the risks more for the baby, the mom, or both?
So there's really not too many risks to exercise in pregnancy other than risks of good body mechanics and using proper form. There's some increased joint laxity in pregnancy, so you want to make sure that you're using those proper body mechanics and form, not doing too much weight that you wouldn't normally do anyways outside of pregnancy, and just being aware of the changes in your balance and your posture as you go through each trimester and you start to carry more of a load in the front with your baby. There's a few certain things that we do recommend avoiding in pregnancy because there are unique risks. So I don't advise women to do any of those exercises where they're in extreme heat temperatures, so like hot yoga or any sort of hot exercise, because particularly in the first trimester, you can increase the risk of spina bifida to your baby, neural tube defect, if you are in saunas or hot, like extreme heat temperatures. So that doesn't mean you can't exercise outside in the summer, or if you can't exercise, you just have to stay well hydrated. So dehydration too, you want to make sure that you stay well hydrated. When you're pregnant to begin with, you need to intake more fluid because your blood volume increases by 50%. And so I am always counseling patients to increase their fluid intake anyway, so if you're exercising, you just have to be able to properly take in more water and hydrate well while you're exercising. I caution women when they're greater than 16 weeks or so, the uterus is starting to get bigger and it comes out of the pelvis, and so you just want to avoid laying flat on your back for long periods of time, and also just standing for long periods of time without much, like standing in place without much movement, because you can, your blood pressure can just get lower and you could get lightheaded or dizzy. Then the other thing I caution them to watch for is contact sports. So I don't advise women to do football or hockey or volleyball where you could dive on your abdomen without, if you're playing the game, you sometimes just do things instinctively without thinking about it. So anything that could cause trauma to your abdomen, I advise against those sports in pregnancy. There's no risk to baby though, specifically unless you did, falling your abdomen, then there is potential risks, so you just want to be careful about that.
There's some benefits of exercise during pregnancy, and again, are the benefits more for the baby, the mom, or both?
Yes, there's lots of benefits for exercise in pregnancy. So first, just for the mom in general, to keep up your strength, there's a lot of changes that your body goes through and a lot of strain on your back, especially as you get into the second and third trimester. So to help keep your strength up will help you adjust all those changes in your body and keep you strong for your pregnancy, pregnancy and delivery. Exercising in pregnancy will help a mom to stay within the recommended guidelines for weight gain. So it's easy to end up gaining too much weight in pregnancy, and then there's no benefits to gaining too much weight. Just more work for you to do afterwards to take it off. So stay within those weight guidelines. And exercise in pregnancy has been proven to decrease the risk of gestational diabetes, which is developing high blood sugar in pregnancy, and blood pressure conditions such as preeclampsia and gestational hypertension. So by exercising in pregnancy, you lower your risks of that, and then you lower your risk of needing a medically indicated preterm delivery, like from developing a complication. One of the other myths in pregnancy is, sorry, my kids, is that exercising can cause preterm labor. That's actually not true. Exercise in pregnancy does not increase the risk of preterm labor at all. So if someone's experiencing active preterm labor, we wouldn't want them exercising, but exercise doesn't cause that to begin with.
What are your recommendations to your patient on how long, how often, or what exercises they should do?
So I give them the guidelines put out by the American College of OBGYNs, ACOG, and at least 5 days a week of moderate intensity exercise and at least 30 minutes with each exercise session.
Are there certain exercises that you prescribe them to do?
A good one if someone hasn't ever been exercising before, just to get out walking or biking on a stationary bike or doing the elliptical trainer. But basically I kind of ask women what exercise they were doing before they found out they were pregnant, and I just tell them to continue it as long as it's not going to cause trauma to their abdomen. And if they're feeling uncomfortable, they can just take it a notch down, maybe lighten the load of the weight that they're lifting, or decrease the intensity of their exercise if they feel like they're more fatigued or uncomfortable.
Activities that should be avoided, according to the ACOG, are contact sports such as hockey, boxing, soccer, and basketball, activities with a high risk of falling such as downhill snow skiing, water skiing, surfing, off-road cycling, gymnastics and horseback riding, scuba diving, skydiving, and hot yoga or hot Pilates. Pregnant women should also avoid exercising on their backs because there is a greater chance for reduced blood flow to the uterus as well as to the brain. The reduction in blood flow may compromise the health of the fetus, while reduced blood flow to the brain may result in dizziness or may even cause the woman to black out. Physical activity in pregnancy has minimal risks and has been shown to benefit most women, although some modification to exercise routines may be necessary because of normal anatomic and physiologic changes and fetal requirements. A thorough clinical evaluation should be concluded before recommending an exercise program to ensure that a patient does not have a medical reason to avoid exercise. Women with uncomplicated pregnancies should be encouraged to engage in aerobic and strength conditioning exercises before, during, and after pregnancy. Obstetrician gynecologists and other obstetric care providers should carefully evaluate women with medical or obstetric complications before making recommendations on physical activity participation during pregnancy. Although frequently prescribed, bed rest is only rarely indicated, and in most cases, allowing ambulation should be considered. Regular physical activity during pregnancy improves or maintains physical fitness, helps with weight management, reduces the risk of gestational diabetes in obese women, and enhances psychological well-being. After all of our research, we discovered that exercising while pregnant is beneficial for the mother and the baby as long as she has no contraindications. Exercise programs should be modified and individualized to the mother. Exercises in the supine position are to be avoided, along with any exercise that raises your core temperature and any contact sports. Overall, exercising while pregnant is advantageous, and we would recommend that all mothers that are capable should do so.
Gon' put it on you. She gon' do that, baby mama. Drop it down, low. Drop it down, low. Drop it down, low. Drop it down, low. Do the baby mama when I step out on the floor. 1 month, 2 month, 3 month, 4. Hit the baby mama when I'm stepping through the door. Yeah, I'm pregnant, but I got an ill flow. Tryna make some money, buy some Huggies from the store. S to the T-A, double R-K, to the E-I-S-H-A. And I don't play. Do it my way, preggo, but I'm still doing moves like Beyonce. Yeah, I said I'm pregnant.